San Diego, the most common sports-related injuries we see are probably related to water sports, especially surfing. We also see a lot of bicycling and skateboarding. So things that are outdoor, people like to be outside and that's great, but sometimes they don't do it safely enough. The most important thing is education. So education on safety equipment, and if they're going to play sports that are potentially risky, just using proper technique, especially with things like football, proper tackling. If someone has an accident involving their head and a parent is unsure whether or not they should bring them in, the safest thing is to just come in and get checked out in the emergency room. But in general, if there's any change in the child's behavior, if they're complaining of persistent headache, or if they're nauseous, then that's something that needs to get checked out. So when a child comes in, the first thing we do is examine them. We do a thorough neurologic examination and assess their brain function as best we can. And usually, if there's any suspicion at all that there might be a more serious injury, such as a hemorrhage in the brain, then we do a CT scan. If you're a parent who has a child that does not necessarily follow directions and is not cooperative with wearing the proper safety equipment, it's really not worth the risk of them having a potentially fatal head injury. It's something that's really non-negotiable, and they need to be instructed and educated on how potentially risky and fatal a bad head injury can be.